section.
Okay. All right, Nick, as you can see, you came to the right place after looking at your x-rays, but before we get treated, I wanted to go over this folder with you, okay? So, on this first page, I just want to go over some information with you. 85% of Americans actually have back pain. That number is really high. And only 40% of those will actually go to the chiropractor and get treated. And usually when people feel better, they'll stop coming in. And so that's why this number stays so consistently high. WebMD did this huge study. It went over 4 years, and it showed that chiropractic cut the need for surgeries and it cut healthcare costs. And there's a huge satisfaction rate, 95%. So we're very proud of that. On this side, you'll find all of the doctor's cards. So on Dr. Garza, you met Dr. Rupert yesterday also. We're the ones that are going to be seeing you mostly. We have Dr. Togel and Dr. Wynn. And we also have our Paler location, so if you know anybody that lives in the Paler area, you can send them over there to her, okay? This forms right here, we're going to go over in a minute, but the main thing I want to point out to you is that the doctors don't know what any of the patients pay. We just focus on getting you better. So any financial questions, the girls will answer for you. And they're actually going to review your insurance benefits with you once we're done with this little consult. Okay, so you saw in the video what subluxation is. It's when the spine's out of alignment, vertebrae pressure to the nerve at that level. And when you have that, you'll have the pains that you're having. So you're having tension between your shoulder blades and mid-back pain. You can even have loss of normal movement in the neck. I'm sure all of these are sounding familiar to you, and it could also explain why you're having the headaches that you have. So what we need to do is do the adjustment, get the pressure off that nerve, and then release all the muscles that are so tight and pulling on the spine in that area. Okay? So everybody has this. Degenerative, but not everybody has pain from it. So that takes a while to add up. So the degenerative process, that's when the bones change shape. And right now, your bones actually look pretty good. You don't really have any disc space that's decreased. So you're actually doing good there. You're only between normal and mild. All right? So what we want to do is, because you're starting to lose a little bit of the neck curve, we want to do some adjustments and encourage that neck curve to come back. But we're going to also have to do it through teaching you rehab care. And we'll tell you about that in a minute. So what I want you to also get from this is not just that you're going to feel better, but chiropractic slows the degenerative change down. By every day you put stress on your body, and that stress causes your spine to adapt to what you're doing to it. For example, if you're at a computer, which I know you are at work, you're at a computer and you're sitting and you're kind of hunched over at it, then that's why you start to lose that curve. Well, one of the reasons why you start to lose that curve. But if you can do something to counteract that, like come in here, get adjusted, and then do the stretches that we're going to teach you, the rehab care that we're going to show you here, that's going to help to get your curve back and slow this process down. So your back's actually going to stay healthier long term, especially when you stick with wellness care here. All right, so why do I feel this way? You have some irritation and pinching on your nerves. Not so much pinching, but definitely irritation on those nerves, and that's what's causing pain. Okay? But why is that there? Because the muscles, they've changed, your spine has changed, and you have abnormal motion going on, which are the subluxations. You can't have normal range of motion if you have a little restricted or subluxated vertebrae. Does that make sense? So what we want to do is adjust the spine, release the muscles, because right now there's an imbalance between the left side and the right side. Remember yesterday on your exam how much tighter your right side was compared to your left? And you had a lot more tender spots on that side, that shoulder blade. So we need to bring a balance from right to left and adjust you. And then that will help with the spinal wear and tear, which is just that decrease of your neck curve. And that'll all ultimately eliminate your back pain and slow down the spinal wear and tear. Okay? And I don't think there's really any tissue damage going on. If for some reason I think that, you're not responding as quickly as you should be, then I'll refer you to get an MRI or something like that. But that happens very rarely because people respond so great with the care that we give here. So on this side, here's your treatment plan. Okay? We do a series of adjustments. We recommend a treatment plan for everybody. It's not a contract or anything like that. It's just our recommendation, what we feel is best for you. And when patients follow through with it, they have the best results. Okay? So what we want to do is move you through these stages of care is pain relief, correction, and then stabilization. And our goal is maintenance. Maintenance is where we like to see our patients. That means that they're coming in here just every once in a while just to help keep their body in good alignment and help keep their nervous system working like it should. So, with pain relief, we typically start patients off at 3 times a week. That's very common. And then we go down to twice a week, and then we go down to once a week. So this is the frequency that we see most often with our patients works best. Sometimes people may not be able to move their head at all, turn their head at all, or they might have some, will you pause it?